Breast cancer is one of the leading cancers in women in the U.S. Breast cancer is a cancer that forms in the tissues of the breast, usually the ducts and the lobules. It occurs in both men and women, but is more common in women. In 2009, over 192,000 new cases in women were reported, and over 40,000 women had died of breast cancer. 1 out of every 8 women are diagnosed with breast cancer, about 13%. I'm here today to tell you about the diagnosis, the risk factors, and the different stages women go through in their struggle with this deadly disease. Let's begin with how breast cancer is diagnosed. The first struggle of breast cancer is the diagnosis. Breast cancer can be checked in 2 ways of mammography. According to Saving Women's Lives, one use of mammography is screening. Screening is an X-ray procedure that is done on women with little to no signs or symptoms. X-ray is done to find the early stages of breast cancer. The second use is diagnosis. Diagnostic mammography is also an X-ray procedure, but is performed on women with known symptoms or signs of cancer. It may detect if they still have it or if the cancer has subsided. Breast cancer doesn't always have symptoms in the early stages, which can make it hard to detect. Breast cancer can have little to no symptoms in the early stages, although one symptom can be a small bump in the breast, but may be too small to detect. Most diagnoses are found in screening and are later detected after more testing is done. According to breastcancer.org, in some cases it may be detected by feeling a new lump or mass tissue in the breast. A lump can be painless, hard, and uneven. It is most likely diagnosed as cancer. Other symptoms are swelling in the breast pain, and dimples, just to name a few. The diagnosis of breast cancer can be very hard, but the stages following can be even harder. The struggle with breast cancer can be tough emotionally and physically. According to Meeting Psychosocial Needs of Women, there are 3 different stages of the diagnosis in breast cancer. The first stage is the local stage, which is most common at 63%. The cancer is defined to the breast. The second stage is regional stage, where tumors have spread to the lymph nodes in the breast. The third and most threatening stage is the distant stage, where the cancer has spread to different parts of the body. Breast cancer can be emotionally and physically draining to all those who surround it. Some psychosocial concerns reported by women in Meeting Psychosocial Needs of Women are fear of reoccurrence, physical symptoms such as fatigue, feelings of being vulnerable. Today there are more treatments to cure breast cancer. According to breastcancer.org, options for treatments are surgery, chemotherapy, hormonal therapy, and radiation. Along with some struggles, here are some risk factors. Breast cancer is one of the leading cancers in women, besides lung cancer. There are many different risk factors for breast cancer. According to the National Cancer Institute, just being a white female increases the risk. The risk also increases with age. Surprisingly, according to breastcancer.org, smoking is also a risk factor. The most inherited cases of breast cancer are connected with 2 genes. The genes are BRCA1 and BRCA2, which stand for breast cancer gene 1 and 2. These 2 genes control growth in the cell in the breast. If they contain mutations, there is a greater risk in breast cancer. Now we know how breast cancer is diagnosed, and clearly it can be draining mentally and physically. And we also know some leading factors. Hopefully we can all be alert and stay healthy.